Good morning. This is Steve Stites, Chief Medical Officer, University of Kansas Health System, back here with you this morning. We have some great guests today as we're going to talk about stress and COVID dreams. I don't think that's really the official term. That's my term that we've been putting on, that I use with my patients. So with us, of course, Dana Hawkinson, Doc Hawk. We'll be talking about some of the infection control, infectious disease issues that are confronting us. Suzanne Stevens, who's the director of the sleep clinic and a neurologist here at KU. She joins us this morning. And Greg Nawalki, I can't say it. How do you say it?
Nawalanic.
Nawalanic, clinical director down at Strawberry Hill. Greg is a really good person, and I apologize for butchering his last name. Those who really know me know that that's a common occurrence in my life. So I'll try to do my best around that. So
it's been common in mine too. So it's
yeah. Well, try to have a last name that is Stites. It comes across as Stitties and Stits and Sites and thousands of other things. So anyway, hey, a couple of important announcements this morning. First of all, our guest for tomorrow, it will be Senator Moran, who returns to the program to talk with us about some of the financial relief and plans and things that are coming out of our Senate colleagues. And then Doug Gasson, who's a Senior Vice President, Chief Financial Officer here at the health system. We're going to talk a little bit about the financial impact of healthcare. Some of you may have heard that and heard that almost a third of the drop in gross national product can be attributed to the drop in healthcare as people don't come and get care. So we're going to get into that topic a little bit more, how it's happening locally and how it's looking nationally. I want to talk about, for just a quick moment, just to update you about a really important event that's occurring here at KU today. Operation Barbecue Relief. Now, I didn't know a lot about this. You'll remember going back to the Joplin tornado. There was a lot of barbecue that was delivered by a group of people from Kansas City. That's a pretty big deal, down to the relief workers and to the folks affected. Today at 11:30 a.m., Operation Barbecue Relief, which has delivered meals and barbecue nationally from Kansas City, will be delivering their 4 millionth meal here at KU, and they're going to feed the heroes that are here, our frontline workers, our healthcare workers, the health system, and others that are here. We want to say thank you to the people who do that. It is a measure of public support and the great work that this organization has done when you think of all the places they've reached out to. So you can watch that live if you'd like. Twitter at KU Hospital News and Media. The feed on this will be from the same TVU address as this is. So I think that'll be really an important event. And I think we were saying this morning, I had an early morning meeting on the university side, and we said, pandemics are hard. They are hard. Actually, they're really hard. And what makes it survivable is the connections between people and watching the best of us, the best sides of us, take shape and present themselves. So things like Operation Barbecue Relief and the others, the frontline workers, I talked about the nursing staff yesterday. People like that, that's what gets us through this. Dana, how are our numbers this morning?
Hey, they're pretty good, Dr. Stites. We have kind of reached an equilibrium, thankfully. I mean, we would like to see no cases, but certainly the last couple weeks we've had about 30 patients, even less. Currently today we're at 26 patients in the hospital. We have 9 of those in the ICU, so even compared to yesterday we have had some discharges, which is a very good thing. Hopefully we can continue that trend, and we just got to continue to see what this next week brings.
Yeah, it is interesting that as we watch the numbers go up around us in Wyandotte County, Johnson County, the metro, et cetera, we're at this equilibrium. We've been between 20 and 35 patients here, 25, 35 patients for quite a while. What does that mean? 'Cause it feels like that means the number of people we take in is directly related to the number of new infections in public and the number of discharges. Those all seem to if you just looked at it from a purely hospital perspective at KU, you'd say it has to be in some state of equilibrium. But it doesn't feel like that when I look at the numbers. It looks like things are really escalating.
Right. Yeah, and that's a real concern. You know, I don't know why our experience here would be much different than, say, New York or Detroit or other places where they have large amounts of of patients and cases that they know of, they do see, and they have seen, a large number of hospitalizations and critically ill patients. I think, again, we need to continue to wait and see what happens. Hopefully we won't have the hospitalizations and the surge, and hopefully we'll continue to have PPE and the right medications and enough ventilators. But this is one thing that we just got to continue to watch one day at a time. This is our new normal, our new equilibrium. Hopefully we don't get above that, but the only time will tell.
It is encouraging, and it just is a measure to the wise. First of all, thank you, Kansas City, because we think a good part of this goes back to you and the way you've sheltered in place. And as the stay-at-home orders begin to transition, remember, there's still no place like home when it comes to safety. And we encourage you to, while you go back out to society, go back to work, do those basic things around infection control. Keeping your distance, that 6-foot thing's really important. Wearing a mask, washing your hands, not touching your face, coughing to your elbow, and if you're sick, stay home. We have bent the curve, and all of you are to be congratulated. I want to turn first to Greg and just about this topic around stress and sleep disturbance. And again, I call it COVID dreams. I woke up at night with one, I think, every night for the last 6 weeks. That's been true. Talk to us a little bit about this, and then Suzanne, I'm going to turn to you and just kind of tell us your opening thoughts here, and then we'll turn to our media.
Thanks, Dr. Stites.
And welcome back to the show.
Yeah, no, thanks.
Even with the little kind of cool thing in your pocket there, I'm not that cool.
Great to be here with the pocket thing.
Yeah, with the pocket thing. Yeah, pocket thing. It's fancy.
We try to elevate things here. So, yeah, right. So I feel like right now, people have been dealing with anxiety and depression throughout this entire lockdown. And now as we move towards opening, I feel like as much as people were looking for that and hoping for that to be kind of the answer to resolve a lot of this, it's actually having quite an opposite effect because of the manner in which it's happening, the mixed messaging from federal level, state, local, and also friends, family. This has been a very relative situation. So it looks very different for different age groups. It looks very different for different professional situations. And people have been able to find different outlets that will support whatever they want to hear. The one thing that's been consistent has been the medical message and what people can actually control and what they can do. The problem is that when we get into more of this gray area and people have their own take on what needs to happen, it's getting pretty nasty out there. I don't do Facebook because I actually value peace in my life, but my wife has given me little snapshots into it here and there, and it's upsetting. A lot of the stuff that I've read, like she watched me just light up in response. I'm like, okay, that's enough. Like I dipped my toe. I understand what's going on, but people have it's been extraordinarily polarizing. It's become a real source of conflict. And this is the stuff that we really can't afford, because when we get angry, it activates a lot of the similar processes as anxiety, which serve to really negatively impact our ability to process information, which is essential at this time, especially as we're getting so much of it, and also our impulse control. And then if we add to that complications like people drinking more alcohol, which they feel is a great coping skill, though it's never been ever, and that's also something that can impact our sleep that I'm sure, Dr. Stevens will be happy to talk about. So that's kind of let's dive in from there, but it's a really interesting time, to say the least.
Pandemics are bad, and they're hard.
They are hard.
They are hard.
That's fair.
And Suzanne, and thank you, because you just reflected my thoughts about all that. Spot on, so thank you. Yeah. So Suzanne, COVID dreams, man, they're not good. Help us with that.
There are many different, I'm going to put it this way, depending on what your experience is with this pandemic, it will be reflected in your dreams. So healthcare workers, they're undergoing trauma, psychological trauma for what they see every day. Healthcare workers who are in the midst of this, they tend to dream more about the actual situations they're in. So their dreams reflect more of their reality. And that's true with any post-traumatic situation, PTSD. The people that are not directly involved, that are on lockdown, that are worried about their family getting infected, their financial situation, their dreams are more anxiety provoking. They can be directly fearful of being infected. It can be zombies that become a metaphor for this invisible alien, that could attack you. And we don't have any data on the dreams from previous pandemics, but there is some records of Hiroshima and some like dreams that were reported after Hiroshima. And a lot of them were about this invisible enemy. Like they were worried about the radiation, this invisible enemy. And that's a very common theme today as well. So I think it depends on what perspective you are coming from. And then there's a third category called lockdown dreams, where people feel like they've done something wrong and they can't leave their home and they want to escape.
Yeah, those I haven't had so much of the latter, but the first two definitely, I think for a lot of folks that's probably going on. And it is, man, I went through the AIDS epidemic. That was really hard. I am that old, but then this pandemic is just so encompassing and so unknown. It is probably the challenge of our times, at least the immediate challenge of our times. So, questions from the media or others that are out there? I'm hearing no questions, so that means I get to start with one.
I do have some questions. I was just giving everybody else a chance to ask them.
Yeah.
So, somebody was asking about traveling in the fall. I think you probably touched on this a little bit about just doing things incrementally already. But what do you think about that?
For traveling next fall, is that kind of the flavor of that, Nate?
Well, I think that traveling this fall or even November, this person was very specific.
Yeah. Okay, in November.
Yeah.
Hard to predict.
It's absolutely hard to predict. I think we would all like to travel, go someplace fun. We have to go one day at a time. This phased reopening is going to go one step at a time. We have to continue to see what the numbers are, what the infections are. Understand the place that you're going. Obviously, it's in the community. It's in the nation right now. I would certainly probably recommend only domestic travel. We do have a little bit more control over that because it's our country as far as being safe and things of that nature. We have talked about flight versus driving. We think driving is probably a little bit more safe. You have a little bit more control over that. But I think, again, one step at a time, one day at a time. Maybe you can start to plan, but I think over these next few weeks, we may have a better idea than we do right now for that.
I think it's about who's in your circle and who's not. If you're in your car within you, the people who are in your circle you're around with all the time, and you can drive from one location to another where you're not going to be introduced to a new circle, then, okay. I think by all means, if you can go to a cabin in the woods and you're not going to see anybody, the big thing you have to do is take really great precautions. You stop to get gas, you bring your own food. There are things you can do to modify your life. It won't look like travel has in the past, and it won't until there's a vaccination and or effective therapy. We've talked earlier this week and last week about the real hope around remdesivir, and I saw yesterday Gilead Pharmaceuticals is trying to work with other pharmaceuticals to ramp up production so it can go worldwide for distribution. That's a great outcome. We'll have to see what it really means to how patients do with it. But I think the impact of drug development and vaccinations will be dramatic on the travel industry. In the meantime, you just want to stay safe and you want to try and do the best you can. My family and I have talked about trying to go someplace this summer. It's going to go to a tent in the woods. It's just going to be a few of us, and we're not going to be around anybody else. But I think that's got to be kind of the gist of how the safest travel will occur. Other questions?
Yeah. I have a couple. One of the things that came up yesterday quite a bit is antibody testing, if you want to talk about that. And then somebody this morning was asking if there was a new strain of COVID-19 that is spreading.
All right, we'll take two, and then I have a question for our guests. So let's first of all start around the antibody testing, which it looks like, Dana, there's some good news finally on that front.
Yeah, I think we are starting to finally see adequate tests, meaning they are adequate and very good sensitivity and specificity in telling you that we did detect the antibody, it truly is coronavirus, COVID-19, or we did not. So that is becoming more widespread, and as more of these labs and companies are getting data, they are able to better verify that it's actually an adequate test to do, because that's the main goal. Is we want to make sure that if we're doing the test, the answer is correct.
And can I just add, I think one of the things that has made it harder for most of us and harder for the public is that the FDA has said through their rapid acceleration program that a lot of these testing methodologies were released before they had all the data around them. Now, historically, the FDA has been accused of working too slowly and it takes too long, but the things you got worked. And because of that. And so the flip side is when they got these early authorizations, they said, fine, go out and do it, but then finally give us some data and tell us let's prove that if your test is working or not, which meant the testing technology got released before it was really verified. And that's the downside of it, is that a lot of the testing technology, quite frankly, didn't work. And it didn't really nail down COVID-19 viruses. It could have gotten any coronavirus, as an example. Or it may have just missed the virus altogether, or in this case, the antibodies altogether. Yeah. So now the FDA said, look, you could still get the things out, but within 10 days of your release, you now have to give us the data that shows you're accurate. So they've tried to find a middle ground. In the meantime, there are a couple of the testing methodologies that actually really do look good. And that's going to be a game changer. And at least we hope that it's a game changer, because we'll start being able to look at information of whether or not people have antibodies, how well they're responding, and whether they can get the disease again. And can those people with high antibody levels give plasma that's really significant to others? That, and I also saw an interesting article over the weekend or yesterday about llamas being a good source of coronavirus antibodies. Not sure. Maybe that'll work. I don't know. We'll take anything right now.
Yep, I saw that.
Next, are there these mutant strains of SARS-CoV-2 that tend to be worse than others?
Yeah, that's an interesting story about the virology. So early on, they felt there was I think it was an S strain and an L strain, maybe in China. Since that time, different things have come about. There's been a recent non-peer review that's waiting for the peer review process that's looked at the molecular structure in the actual base pairs and the mutation. So I think we need to start out by, this virus really has not mutated a lot since the original China strain. So maybe just between 15 and 20 base pairs, maybe that. We understand that even one mutation in a base pair of the genome can cause a significant change. So
some of those changes could be good or bad. Right. It can make it worse, or it can make it a little less bad.
They can increase the virulence, the infectivity, all that. What they found is maybe there was a amino acid change in the spike protein that maybe cause it to be a little bit more hypercontagious. I think we still need to get more information, but that was a thing. There was one strain circulating early on, but then there's a new strain from Europe with this mutation in the amino acid that maybe just causes it to be more hypercontagious or more virulent. So I think it's interesting the way the virology is going, but we need to continue to evaluate that and look at that for sure.
And that peer review process is really important. As an example, I have a lot of great ideas. And then my lovely wife of 33 years peer reviews my ideas. And oftentimes there's approximately 1,227 reasons why my idea didn't work. Peer review is really exactly that, right? You think you have all these great things, you got it nailed down, but unless others have looked at your thoughts critically, you're thinking about your own thoughts may not be nearly as important. So these things are starting to come out without peer review because we're in a pandemic. And as a result, stuff is coming out. One of the things about this came out at the Los Alamos Laboratory, a lot of brilliant people. Yeah. But, I know that Anthony Fauci looked at that and said, yeah, not so fast. And so I think you just have to be really careful without peer review, without our spouses looking over shoulders to tell us why that perhaps was not the best thing since sliced bread. So, Greg, when you think about all this stuff that you're hearing, what are the things people can do to help themselves?
The one thing, it's a good question because...
And I'm not going to peer review this, by the way.
No, I mean, I'll give you peer-reviewed information.
Okay.
It hasn't changed.
A handkerchief right there. I'm not peer review.
My wife didn't get a chance to see it. I left it early. That's how I escaped with it. The message in terms of how to cope with this hasn't changed, much the same as the medical response of how to limit our risk hasn't changed. You want to be using deep breathing and relaxation techniques. It really is the absolute most effective means of reducing that anxious response adaptively. You want to be looking at actually acknowledging the anxiety, trying to figure out why are you feeling the way you're feeling? Is it just because there's this frenzy and it's just this nebulous cloud of worry, or are there specific impacts that you can respond to in some productive, meaningful way? The anxiety gets worse when we don't have any sort of control that we can exert. And so in this situation, this is where that dance of reopening becomes very unsettling for a lot of people, because they feel that what they have in place has been working for them, and now other people get to decide what their response is going to be, and then they're all going to be mixed a little bit. Hopefully everybody's going to maintain social distancing, but I think just in microcosms of the larger picture, you look in neighborhoods, and you see a wide continuum of people's adherence to social distancing. Drive-by parades turn into everybody hanging out in a cul-de-sac and talking just like before, but in smaller groups, but they're still right next to each other. And the problem with this disease is that spectral piece of asymptomatic infection. And so that's where the anxiety really tends to get spiked, is the idea that if I'm coughing, if I've got a fever, then I know. Or if somebody else I can see and say, whoa, stay back, you're way too close. But when you're just like us right now, we're sitting here, and who knows? I mean, I think we know. But
we are apart.
I got my 6
We are.
feet
I say we are.
How about that?
See,
We do work at that in the studio. That's right.
We are physically distanced.
We are.
And so
we wear
it's-
our mask as soon as we walk out of here.
Right.
I've got
So-
my mask. I know how to put it on. Well,
I've
that was
got
a bad
mine.
example. Don't mimic that. But point is, we do know how to do
We
it.
are having good
them.
practices.
We have them.
Yes. So, but the point being that out there in the rest of the world, people have a wide range of appropriate practices. I saw a meme of a woman wearing a mask with the nose and mouth cut out. And somebody asked, what are you doing? She said, it's a lot easier to breathe like this.
Yeah, that may not work as well like that, huh?
No, not
my
at
wife
all.
Would, I would peer review that.
Yeah, I would hope somebody would peer review that. But the point is that in her mind, she had the mask on. She was doing what she needed to do. And I don't know. You just have to look at what you can control, doing deep breathing, getting exercise, get outside, stay socially distant while we're outside. And all these things will also help with the sleep piece. And I know, we want to get Dr. Stevens in to talk more about that. But one thing I want to say to that is one of the biggest problems that we have, anxiety can obviously impact our sleep. We can have the night waking and all this and that. But there are a number of things that you can do that are known as a group as sleep hygiene, which is maintaining routine, going to bed at the same time, keeping the screens off an hour before bed, keeping your bedroom dark and cool, a number of different things that if you do these and stick to them, and also when you wake up in the middle of the night, don't get up and go walk to get something to drink or something to eat or turn on the TV. These are all just shooting yourself in the foot. And so if you're taking control of your sleep, you will sleep. It will happen. But the worrying about worrying creates this cycle, and the worrying about not sleeping creates this vicious cycle. And so we want to interrupt that. We want to know that we're doing the best that we can. You have a plan in place, and it's your personal plan that you're comfortable with that works for you. And so it's kind of the best that I can throw out there.
So, Suzanne, other advice for us to do a better job of sleeping, because, man, we know not only are we stressed, not only are pandemics bad, but when you're sleep deprived, despite being in bed for a long time perhaps, but when you're sleep deprived, makes everything worse.
Very much agree with that. So what we're talking about with anxiety is not only what's happening in the world, but how we respond to it. And typically, anxiety begets anxiety. So if during the day you're exposed to constant negativity, if you're constantly checking your phone for updates, if you hear about all the new deaths, if you hear about the bad things, that's what you're going to dream about and think about at night. So one thing we can do is limit exposure to this constant barrage of negativity. And for example, instead of having news blasts all day long, set aside certain times during the day, whatever times, morning and night, and maybe 2 trusted news sources. So you're not getting, your updates from Facebook or something like that. So it's this balance of positivity to negativity that will greatly impact our quality of sleep and also our dreams. So the reason why we call nightmares is because it's our response to the dream. And that's what wakes you up. So, you may have a bad dream sometimes, but you won't remember it because you slept through it. But if it reaches that threshold where it really causes your heart rate to go up and blood pressure to go up and worry to ensue, that's when you're going to wake up. And sometimes people wake up with a fast heart rate, short of breath, and they just have to kind of compose themselves. And then they think, oh my God, that's a horrible dream. They start thinking about the dream, and that's more anxiety. So you mentioned before about this pandemic, as awful as it is, can bring out the good side of people. So that good side of humanity, being kind, having great interactions, having caring interactions will boost the positive side of that ratio. And also getting outside, exercising, and just remembering, getting perspective is difficult, especially when we're isolated like this. So you need to reach out and have positive interactions, again, to kind of balance the ratio more towards positivity. And then the other interesting thing about the sleep patterns is, since people are working from home more, they tend to be sleeping in a bit later, or they, going to bed a bit later, sleeping in a bit later because they don't have the commute that they have to do. So we get most of our dreams in the latter half of the night. And so if you're usually get up at 6:30, but you're waking up at 7:30 now, you're going to have a lot more intense dreams, because as the night goes on, dreams become a lot more intense. And then people are remembering their dreams more because of that. So the structure is really important. And the anchor, you need these anchors during the day to know actually kind of like what day it is, because usually we have these anchors of kids going to school or various meetings on certain days of the week, and we don't have that right now. So it's kind of like we're floating along sometimes, and we're just kind of lost. So that waking time is an anchor that sets the tone for the rest of your day. And if you wake up, get sunlight, if you can go outside, it's better, because that's the best sunlight for your brain to get the message, it's time to be awake, that sort of thing. But if you can't go outside, at least opening the curtains, turning on lights, just you need light during the day, so your brain knows it's time to be awake. Increasing the positive interactions, exercising, of course, limiting negative information. And the other thing, at nighttime, sometimes it even helps psychologically to shower, make sure your sheets are clean. If you go outside, if you have to go to work, you have to go to the grocery store, and you're thinking, did I get exposed to somebody? Did I, that sort of thing. If you shower at night, it not only gives you that feeling of cleanliness, but it raises your body's core temperature. And when you get out of the shower, the temperature starts dropping, which is what our body naturally does when we get sleepy. So when we get sleepy, our body temperature drops. You're kind of artificially trying to imitate that. So you can shower, and that helps you relax. It helps your body temperature drop. Go to bed, make sure you've got clean sheets. That sort of thing helps a lot too. And a comfortable sleeping environment in the 65-degree range is what research shows is supposed to be the best.
I appreciate that 65-degree thing. I'm going to tell Sandra Stites that tonight, that I get to turn the thermometer down.
Oh, no.
So I can sleep better. That thing about what do you read? Where do you turn to for your sources of truth and some source of calm? I try to read a couple of different, I'll read the Wall Street Journal, and it's like everything the Democrats do is terrible, and everything we're doing, the Republicans do is great. Then you go to the New York Times, everything the Republicans do is terrible, everything the Democrats do is great. And you're like, man, and then you try and read them both, and they're so depressing. You think coronavirus is bad enough, but when we are forced to think that every single thing on the earth is about to die at every moment, it just makes you depressed. So then I try and turn to the sports section, and there's no sports. I mean, come on, I gotta watch some Chiefs and some rest, and then fine. Well, thank goodness for Parks and Rec, because that helped last week. But that there is a way to try to find balance in your life, and you may not be able to find it from your traditional sources right now. And I think that just means friends and family take on that much more importance. So, questions out there?
Yeah, I haven't. Somebody wanted to know if there was any tip or trick that would help her to go back to sleep quickly if you wake up in the night with anxiety.
Oh man, that's a good one, Suzanne. What are you telling? What should we do? And Greg, after that, we'll see what you guys think.
So backing up to kind of how sleep has changed, people are staying in bed longer, so their sleep is less efficient. So the less efficient your sleep is, and the longer you stay in bed, the less likely you are to be able to go back to sleep if something wakes you up. In other words, if you have a high sleep drive and you've been busy all day and you didn't sleep till noon and trying to go to bed at 10 p.m., you have a full 16-hour day of wakefulness, and then you limit the amount of time you're in bed to what is appropriate, you'll go back to sleep a lot easier if you wake up with a bad dream because that sleep drive is so high. On the other hand, if you're staying in bed 8, 9, 10 hours, your sleep drive is very low. So you're gonna sit there and think about this and think about this. So going back to things like deep breathing was mentioned before. That's a really good thing to do. And it's hard sometimes when you're anxious to deep breathe because maybe you count in 1, 2, 3 as you're breathing in. And as you breathe out, 1, 2, 3. And then all of a sudden your mind is wandering back to the dream or back to work or back to this or worry, this, that, and the other. You just have to do it again. You just have to constantly go back and focus on something other than what worries you. The brain can only do one thing at a time. So people think they can do 2 things at a time, but I think it's more just switching back and forth really quickly between things. So if you can refocus on something other than the anxiety, whether it's deep breathing, you can do visual imagery, which if you can think of a pleasant place, and that's different for everybody, of course. Some people think a beach is pleasant or a childhood home. You're supposed to envision that and engage all of your senses. So if, say it's a beach, if you walk barefoot on a beach, you're supposed to feel the heat of the sand, the grains of the sand, see the blue sky, see the clouds, hear the waves, see the seagulls, hear the seagulls, see the people, see the umbrellas. And as you're engaging your senses, that really is effective. The same thing can happen where you're trying, you just get to the shore and then all of a sudden you're thinking, oh my gosh, this pandemic is awful. Got to start all over from step 1. But it is very effective to do that. So I'd say keeping a regular sleep time. Sometimes people like to write down their dreams. And so if you want to write it down, or it's easy to like speak into a smartphone so you can record the dream. That way it's out of your mind, because as we all know, sometimes we can have these really awesome or negative dreams. And we're like, that is really interesting. I want to think about that. And then by the time morning comes, you forgot it, just because that's what dreams do, is they kind of go away. If you write it down, get it off your mind, that's one way to deal with it as well.
Greg?
That was a pretty comprehensive answer.
That was a great answer.
She kind of
I'm
stole.
going to try it.
she took everything I had.
Here's what you guys did. You blew up my thing that I do in the middle of the night. I go downstairs and I eat, and then I read the Consumer Reports or something, or look at my phone. You're telling me that's really bad health, huh?
Yeah, not the best
not the rest
thing
of,
that you
I
want
should
to
do meditation.
Like she said, really one of the best things is having a go-to, like a set personal memory, something you've actually experienced. So you're not trying to create something in your mind of somewhere that you'd love to go. Think of something you can actually re-experience, and hopefully most people have at least one of those. And that's really, with the deep breathing, it's going to be the most effective. And then trying not to, it sounds really obvious, but block all the thoughts about I'm not sleeping, which are going to certainly barrage you in that moment. You're going to have just this overwhelming, oh my God. And one thing, keep those visible alarm clocks out of the bedroom. You do not need to know what time it is that you woke up. The only thing that's good for is for complaining to someone the next day about what time you woke up and how long it took for you to get back to sleep. And the fact that you're mindful of that, that's something else your mind's running on. So we want to keep your phone, if you can, if you don't have an emergency need for your phone, plug it in somewhere in another room so it's not on the nightstand, because Lord knows social media is a wormhole. Like you pick up your phone and you've lost an hour in no time, because if you follow enough Instagram accounts, by the time you scroll through to where you were, it's amazing how much content pops up at 2 a.m. apparently. So you just want to try to keep your bed for just, sleeping. Keep your bedroom for sleeping and sexual activity are the two that you're supposed to use for, nothing else. So when we're working from home, something that can really impact our ability to sleep well is if we're doing work in bed. Terrible idea, because the brain is a extraordinarily complex but ultimately very simple tool. It likes to match things. And so when you're lying in bed doing work, watching TV, reading stuff, any of these things, your brain thinks, oh, we're here in that place. This is what we do. And as we've now shifted to working from home, you're doing that from your bed. Now your brain is starting to associate, so I don't do this in the office anymore. Now we do that here. Okay. And so now when you're asleep, you might have dreams about work, like wondering, what's an email? I didn't send this. I didn't do that. And so the more that we can separate our sleep and the rest of our life, the better our sleep's going to be and the higher quality. And also, with working from home comes the ability to take a cat nap in the afternoon. don't do that. If you're feeling tired, go exercise. I know it sounds completely counterintuitive, but you'll get an energy burst. They'll be able to carry you through the rest of the day. You'll release those positive feel-good endorphins, and it's going to sustain. You also have a better sense of self-esteem that you did something positive. So it's a win-win. And then at nighttime, when you're actually tired, you'll go to sleep, and you should have more deep and restful sleep. So really what you're saying is my brain has to be trained, so that just means my brain is like a dog. My brain's a dog. That's what you've just told me. My brain's a dog. And true. No more Cheerios and blueberries at 2 a.m. Fine. Jim.
I have a question from someone named Cindy, and they say they're asking, I have anxiety over going back to work. I have anxiety over people who may have tested positive for COVID and now are coming back to work.
Yeah, those are real fears, and there's no easy answer to that. The one thing I would just say, and I know Dana would probably say, is that the better you can make sure you're isolated at work, and this is something that the county health departments are stressing to employers. You have to you can bring people back, but you have to maintain physical distancing. Otherwise, not sure you can reopen in the same fashion. And I would just say, as a healthcare provider, that is like the most important thing, right? Got to maintain your distance. Yeah, if you try to wear a mask, wash your hands, and don't touch your face. If you do those things, your chances of staying healthy are really good, even if the person 6 feet or 8 feet away from you has COVID-19. The data coming out of Wuhan and other areas is when you maintain physical distance, even from people who had COVID-19, you stay pretty healthy. You really didn't get it, Dana.
Yeah, if you're doing the hand hygiene with soap and water or alcohol hand sanitizer, and you're not touching your face, those are important, and those will exponentially reduce your chance of getting it, even if you are 6, 8, 10 feet away from somebody who has had it, and especially if they've had it some time ago. That they should be okay to get back to work, but if you can do those individual things, your chance of getting it are going to be reduced.
So other thoughts about the anxiety side? Please.
Another thing to keep in mind is good sleep. Good sleep helps the immune system. It helps you not get infected, but if you do get infected, it helps shorten the course, is what we're thinking. So it's better to not go into work that stressed. You need your rest. Your immune system works much better. As mentioned before, that sleep loss and stress makes you make really bad choices. So you want to have your emotional state where it needs to be. You don't want to make rash decisions. You want to be very measured in what you do, but you need a good rest to be able to do that during the daytime. So just a thought there that prioritize the sleep also to make your immune system operate at top level.
Yeah, and I think one of the challenges you have when you're at work a lot, or for our frontline folks out there who are here under a lot of stress, is that you do get stressed, and then you do get tired, and then you get a little crispy, and then you start regretting things you said. So you do have to be really thoughtful about that. So what else, Greg, can people do about the anxiety of work?
Yeah, and back to Cindy, I think that if everybody watching this who's preparing to go back to work tries to be as thoughtful and as committed to, I think the city, as you guys said, has done a great job of social distancing, of locking down, of committing to beating this thing. And so that doesn't stop now that we go back. And so we're only as strong as our weakest link. So I would encourage everybody. And Cindy, obviously you're putting a lot of, worry in other people's hands when you look at going back to work. And so as long as you're doing everything that you can do, and if you're communicating to your coworkers the importance of that to you, then you've done all that you can do. And hopefully everybody's going to buy in, because nobody wants this thing. And it's just a matter of trying to help people recognize that this is real. There's a lot of talk out there that some people like to discount it and say, it's not a big deal. This wasn't as big as it was. Well, it wasn't as big because people listened. And it's great that people listen. And thank you to the media for getting the word out, and for you guys taking the time every day to do these. I mean, it takes time. And people listen. And so we still have to listen, we still have to be diligent, and we have to exercise that modicum of control that each of us has to try to be an effective link in the chain so that we don't break down. So I would just say, do your deep breathing, 6 feet away from anybody else, and wash your hands and just try to, keep your work surface sanitized, and that's it. But don't get obsessional about these things, because you're, like you said, if you're sleeping well, if you're eating well, if you're exercising, your body's a machine that can sustain you, and you can try to be as best you can, even in the face of those who might not be doing as much as you would hope they would. So,
I think that those are all great thoughts. We have time for one more question, I think. One last one.
Hi, this is Nate again. I know you've been addressing this, but we had a woman who is living in a county where they haven't had an active case of COVID-19 for at least 4 weeks. But she's also noticed that few people are wearing masks out in public in her city. And so I think this is probably just giving her some anxiety. So what would you say to people who are maybe a little bit more conscious about this than others?
You bet. So one thing is, in that county where they haven't had a case in 4 weeks means they haven't found anybody who's tested positive. I promise you there are cases in that county that are there, and we just don't do widespread testing to know that. So they do exist. Now, that doesn't help your anxiety, unfortunately, because you think, well, how come people still don't do it? Right. And the answer is that, it's harder when you don't see as much, right? None of us take seriously the threats that we may know are out there as opposed to when they're right in front of us. And so it's harder. And I think that the best thing you can do is wear a mask to protect yourself.
Yeah. I think that if seeing the mask heightens your anxiety, it should actually maybe be the opposite. If you're seeing somebody wearing a mask, you should actually feel a little more secure in that. And if it makes you feel even better, wear one yourself. There's nothing shows that having a mask, unless it's soiled and full of COVID, that it's going to increase your risk. So if anything, seeing people with masks, maybe it just reminds you that this is still going on. When you hear 4 weeks out, there haven't been any cases, we should be done. The reality is that people come and go. We travel, as much as we'd like to think everybody's locked down in their home just watching this. People are going out and about. There are essential staff, and they do travel between locales. And so it's a false sense of security to believe that just in that 4-week period of having nobody tested, that you're completely 100% safe just to go back to having barbecues and random hookups. We need to look at actually being responsible, being safe, and waiting until we hear from the experts that this is actually a prudent decision to get back to a more prior routine, I guess.
In the meantime, it's all about the same things we talk about every day. Let's say it one more time. Washing your hands.
That's right.
Don't touch your face. Cough into your elbow. Wear a mask. Don't go out if you're sick. Maintain that physical distancing. So I want to thank Dr. Suzanne Stevens and Greg Nawalanic. I said it pretty close today, I think, not bad, for being on the program today, along, of course, with my right hand here, Doc Hawk. So thanks to all of you who are out there, and have a great day. And remember, there's still no place like home. Tomorrow, Jerry Moran and will be joining us, along with Doug Gaston. And today at 11:30, Operation Barbecue Relief. If you didn't hear about this earlier, this is the organization that is from Kansas City that's been serving barbecue to relief workers all across the country for a number of years. It started back around the Joplin tornado a number of years back. And now they'll be here today delivering their 4 millionth meal at 11:30 a.m. You can watch it live on Twitter at KU Hospital News. The media can follow along at this TVU address. So until tomorrow, stay safe.